As the seasons change and, well, we all start spending more time indoors, you definitely notice more coughs and sniffles going around.
That's right. It happens every year. Being closer together just makes it easier for respiratory germs to spread.
Exactly. But sometimes, what seems like just a lingering cold can turn into something, well, something more serious. And that's what we're diving into today, pneumonia.
Mm-hmm.
It's actually pretty common, and we also want to tackle its cousin, the one people talk about a lot, walking pneumonia.
Yeah, there's a lot of confusion around that one.
Totally. So our mission for you today is simple. Cut through the noise, get clear on what these are, how they differ, who's really at risk, and crucially, what you can actually do to protect yourself and, the people around you.
And for this, we've really dug into the details, pulling insights from leading medical experts in infectious disease, lung health, plus looked at detailed medical articles. The idea is to give you a solid, comprehensive picture without just drowning you in medical speak.
Great. So let's start with the basics. Pneumonia. I think many people just picture someone really sick in bed. But what is it, fundamentally?
At its core, pneumonia is an infection. It causes inflammation in the air sacs in one or even both of your lungs, and these sacs can fill up with fluid or pus.
Okay, inflammation and fluid in the lungs, and that link to the colder seasons.
It's exactly what you said earlier. We're indoors more, closer together, so germs just spread more easily. It's a seasonal pattern we definitely see.
Right. And how do those germs actually get in there?
Typically, you breathe them in, little droplets from coughs or sneezes or just in the air around you, containing bacteria, viruses, or fungi.
So it's not just one thing. There are different culprits.
Exactly, and the type of germ really matters. It influences how sick you might get, how it behaves, and definitely how we treat it.
Okay, let's break those down then. What are the main types?
So first up, you've got bacteria. Bacterial pneumonia is quite common. Often it sort of piggybacks on another illness like a cold or the flu.
So your immune system is already busy fighting something else off.
Precisely. It takes advantage. That cough that just won't go away after you thought you were getting better. Sometimes that's bacterial pneumonia setting in.
Okay, that's bacteria. What else?
Then there are fungi. Fungal pneumonia is a bit different. You usually get it from the environment, not from other people. Think certain types of soil or even bird droppings.
Oh, wow. So not person to person for that one.
Generally, no. And it tends to affect people who have weakened immune systems or maybe other long-term health issues.
Makes sense.
And the third type?
Viruses. These are major players, especially with things we're all familiar with. The flu virus, COVID-19, both can lead directly to viral pneumonia in adults.
Right.
And another big one, particularly for kids, but also adults, is RSV, respiratory syncytial virus. That can also cause viral pneumonia.
So definitely not a single entity. Bacteria, fungi, viruses. And you mentioned walking pneumonia earlier. We'll circle back to that specific one, right?
Absolutely. It deserves its own spotlight because it's often misunderstood. Okay, good. So knowing these different types is one thing, but how do you even know if you have pneumonia? What are the signs we should be looking for? I imagine it varies a bit.
It really does vary. Your age, your overall health, the type of germ, it all plays a role in what symptoms you might experience. But there are definitely common signs.
Like what? What are the big ones?
Chest pain is a pretty common one, especially when you take a deep breath or cough. And the cough itself, it's often persistent.
Persistent, and sometimes it produces stuff.
Exactly. You might cough up mucus that's greenish, yellow, or sometimes even a bit bloody. That's a key indicator. Also things like chills, feeling really wiped out, fatigue is huge fever, sometimes sweating through your clothes at night.
Night sweats, okay. What about other general feelings?
Loss of appetite is common, sometimes nausea or vomiting. And shortness of breath is a really important one to watch for, feeling like you can't quite catch your breath.
Shortness of breath sounds serious. Are there any less obvious signs?
Yes, actually. Especially in older adults, say 65 and up. Sometimes the first sign might be sudden confusion or a noticeable change in their mental awareness. That's a critical flag.
Wow, confusion. That's not something I'd immediately connect to a lung infection.
It's not intuitive, but it's a well-recognized symptom in that age group. And occasionally, some people report pain near their left rib cage, which could be related to the spleen reacting to the infection.
Okay, that's a lot to look out for. You also mentioned earlier that pneumonia can sometimes sneak up after a cold or flu. How do those early stages look?
Right. The early warning signs can be tricky because they often look just like the flu. You might start with a fever, a cough, maybe a headache, feeling weak or achy. Pretty standard stuff.
So how do you tell the difference then? How does it shift?
The key is usually the progression. With pneumonia, these initial symptoms tend to get worse over a couple of days, not better. The cough often becomes more pronounced, maybe deeper.
Her cough, okay.
And you might notice that shortness of breath becoming more apparent. If it's bacterial pneumonia, that's often when you start seeing that thicker, discolored mucus, the yellow, green, or maybe blood-tinged kind we mentioned.
So it's the worsening, the deeper cough, the specific mucus, the breathing difficulty. Those are the clues that it might be more than just flu.
Those are definitely signs that should prompt you to think it might be something more serious, yes. Though, of course, you really need a doctor to diagnose it properly.
Understood. Now, the big question, especially when you're feeling sick, is this contagious? Can I give it to my family or colleagues?
That's a really important question, and the answer depends on the type of pneumonia.
Ah, back to the germ type.
Exactly. So bacterial pneumonia and viral pneumonia. Yes, those are contagious. They can spread from person to person.
Okay, bacterial and viral are contagious. What about fungal?
Fungal pneumonia is the exception here. It's not contagious. Remember, you usually get that from environmental sources, like soil or droppings, not from another person coughing on you.
Good distinction. So for the contagious types, how does it actually spread? Is it like a cold?
Pretty much, yeah. The main way it spreads is through respiratory droplets. When someone who's infected coughs or sneezes or even just talks, they release tiny droplets containing the germs.
And then someone nearby breathes them in.
Exactly. That's the primary route. It's much less common to get it by, say, touching a doorknob that an infected person touched and then touching your face. Although basic hygiene is always good. It's mainly airborne droplets.
Okay. That clarifies the contagious aspect. Now, let's zoom in on that term we keep mentioning, walking pneumonia. What exactly is that?
Right. So walking pneumonia isn't really a precise medical term itself, but it usually refers to a milder case of pneumonia, most often caused by a specific bacterium called Mycoplasma pneumonia.
Mycoplasma, okay. So it's usually bacterial.
Most commonly, yes, caused by Mycoplasma pneumonia. Though sometimes mild pneumonia caused by certain viruses or even fungi might get labeled as walking pneumonia colloquially. But typically, doctors think of mycoplasma when they hear that term.
And why walking? That sounds so counterintuitive for pneumonia.
It does. The name comes from the fact that the symptoms are often mild enough that people, well, they can literally keep walking around. They continue their daily activities, going to work, school, errands, because they don't feel sick enough to be bedridden.
But they're still sick and potentially contagious.
Absolutely. That's the tricky part. They might just feel like they have a bad cold or bronchitis, but they do have pneumonia, and if it's bacterial or viral, they can still spread it to others, even if they feel relatively okay.
That's kind of concerning. How common is this specific mycoplasma type?
It's actually pretty common. The CDC estimates something like 2 million infections from mycoplasma pneumonia each year, just in the U.S. And that's likely an underestimate because, many mild cases probably never get diagnosed.
2 million. Wow.
Yeah, and they've actually noted an uptick, a rising trend in these infections projected between 2024 and 2025. So understanding it is definitely timely.
Okay, so if it's milder, how does it really compare to what we might think of as regular pneumonia? What are the main differences for someone trying to understand this?
I think the biggest difference is really the severity and how much it knocks you out. Walking pneumonia, as we said, usually mild symptoms. You can function, mostly. Maybe a nagging cough, feeling tired, low fever, usually no need for the hospital.
Right, functional, but maybe not feeling great.
Exactly. Regular pneumonia, on the other hand, tends to hit harder. Higher fever, more severe cough, significant chest pain, real difficulty breathing. It often makes people feel so ill they have to stay in bed, and hospitalization is much more common.
And the causes are typically different too, you mentioned.
Yeah. Well, walking pneumonia is often that the Mycoplasma bacteria. More severe regular pneumonia is frequently caused by different bacteria, like Streptococcus pneumonia. That's a really common one for more serious cases. Or sometimes viruses like the flu.
Got it. But some symptoms overlap.
Oh, definitely. Coughing and feeling tired are pretty common in both. That's why you can't always tell just based on symptoms alone, especially early on. A proper diagnosis is key.
So even though walking pneumonia is milder, should we still take it seriously? Can it cause problems down the line?
That's a really important point. Yes. Even though it's generally mild, especially for people who are otherwise healthy, it can lead to complications, particularly in high-risk individuals.
Like who? And what kind of complications?
Well, for someone with asthma, for instance, even a mild mycoplasma infection could trigger a severe asthma attack. In rare cases, it can lead to more serious things like inflammation of the brain, called encephalitis, or certain types of anemia where your red blood cells break down. So mild doesn't mean zero risk.
Okay, so the walking part shouldn't make us too complacent, especially for certain people. That leads perfectly into the next question. Who are those high-risk individuals? Who needs to be most careful about pneumonia in general?
There are definitely groups that are more vulnerable. Age is a big factor. People age 60 or older, and also very young children, say age 2 or younger. Their immune systems might not be as robust.
Okay, older adults and young kids. Who else?
People who are in hospitals or living in long-term care facilities like nursing homes. Infections can spread more easily in those settings, and the residents often have other health issues.
That makes sense. And people with weakened immune systems generally.
Absolutely. Anyone whose immune system is compromised, whether it's due to a condition like HIV/AIDS, cancer treatment like chemotherapy, an organ transplant, or long-term steroid use, they're all at higher risk.
What about just common chronic health conditions? Do they play a role?
They play a huge role. Things like chronic lung diseases, asthma, COPD, emphysema make the lungs more susceptible. Also conditions like diabetes, heart disease. Basically, any chronic illness can potentially weaken your body's defenses and increase your risk of getting pneumonia or having a more severe case if you do get it.
So it's age, environment, immune status, and underlying health. Quite a few factors.
It is. And sometimes it's a combination of these factors that really elevates the risk.
Okay, understanding the risks is one thing, but what can we actually do about it? What are the best ways to prevent pneumonia?
Thankfully, there are quite a few effective prevention strategies. Vaccination is right at the top of the list.
Which vaccines are we talking about?
Several are key. The annual flu shot is really important because, as we said, flu can lead to pneumonia. So preventing the flu helps prevent pneumonia.
Good point.
Then there's the pneumococcal vaccine, which specifically protects against some of the most common types of bacterial pneumonia, like the one caused by Streptococcus pneumonia. There are different versions recommended depending on age and risk factors.
Okay, flu shot, pneumococcal vaccine. Any others?
Yes, the Hep vaccine, which is part of routine childhood immunizations, protects against Haemophilus influenza type B, another bacterium that can cause pneumonia and meningitis. And more recently, RSV vaccines have become available for older adults and pregnant individuals to protect newborns, which is a big step forward.
So keeping up to date on recommended vaccines is crucial, especially for those risk groups. What else besides shots?
Managing those underlying health conditions we talked about is really key. If you have asthma, COPD, diabetes, heart disease, working closely with your doctor to keep those conditions well controlled helps strengthen your overall defense against infections like pneumonia.
Right, taking care of your baseline health.
Exactly. And then there are the healthy lifestyle habits that support your immune system in general. Don't smoke. Smoking damages your lungs' natural defenses. Limit alcohol consumption. Eat a balanced diet. Get enough sleep. These things really do make a difference.
Seems like common sense health advice, but clearly very relevant here. What about just avoiding germs in the first place?
Absolutely fundamental. Good old-fashioned hygiene. Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer if soap and water aren't available.
Especially during cold and flu season.
Definitely. Also, if you're sick, cover your coughs and sneezes. Consider wearing a mask if you have respiratory symptoms, and try to avoid close contact with others, especially vulnerable individuals, to prevent spreading whatever you have.
Simple steps, but they add up to protect yourself and the community.
They really do. It's about layers of protection.
Okay, so let's say despite these prevention efforts, someone suspects they do have pneumonia. What happens next? How is it treated?
Treatment really depends on the type of pneumonia and how severe it is. If it's bacterial pneumonia, the main treatment is antibiotics.
Okay, antibiotics for bacteria. Are there specific ones?
Doctors have several options. Common ones include amoxicillin, azithromycin, levofloxacin. The choice depends on the likely bacteria, local resistance patterns, and the patient's health. They can be taken as pills, or if someone is quite ill or hospitalized, given intravenously.
And you mentioned something crucial earlier about antibiotics.
Yes. It is so important to take the entire course of antibiotics exactly as prescribed, even if you start feeling better after a few days. Stopping early can mean not all the bacteria are killed, which can lead to a relapse, or worse, contribute to the development of antibiotic-resistant bacteria.
That's a huge public health issue, antibiotic resistance. So finish the full course.
Got it. What if it's viral pneumonia? Do antibiotics help then?
No, antibiotics don't work against viruses. For viral pneumonia, treatment is often more about supportive care, rest, fluids, managing fever. In some cases, like with influenza or COVID-19 pneumonia, specific antiviral medications might be prescribed if started early enough.
Okay, so antivirals for some viruses, supportive care otherwise, any other treatments used?
Sometimes doctors might prescribe corticosteroids, steroids to help reduce inflammation in the lungs, especially if it's severe. And if someone is having significant trouble breathing and their oxygen levels are low, they might need supplemental oxygen, either through a nasal cannula or a mask, sometimes even requiring hospitalization for breathing support. So, treatment is tailored based on cause and severity. Now, the critical question: when should someone stop trying to tough it out at home and actually seek medical help? What are the definite go see a doctor signs?
That's crucial. You should definitely seek medical attention if you have a cough that lasts longer than a week, or seems to be getting worse rather than better.
Okay, persistent or worsening cough.
Also, experiencing chest pain, especially sharp or stabbing pain when breathing or coughing. Any noticeable difficulty breathing or shortness of breath is a major reason to get checked out promptly.
Difficulty breathing, don't wait on that one.
Absolutely not. And generally, if your symptoms are severe or worsening, like a very high fever, confusion, bluish lips, or fingernails, which can indicate low oxygen, seek care immediately. Don't delay.
Clear guidelines: cough over a week, chest pain, trouble breathing, worsening symptoms, confusion. Get help.
Exactly. It's always better to get evaluated and get the right diagnosis and treatment started sooner rather than later.
Okay. As we start to wrap up this deep dive, it feels like we've covered a lot of ground. From understanding that pneumonia isn't just one illness, to spotting the signs, knowing who's at risk, and importantly, how to prevent and treat it.
It's true. And hopefully, demystifying things like walking pneumonia helps too.
Definitely. I think the big takeaway is that while pneumonia in its various forms is pretty common, understanding it, really getting the nuances of how it works, how it spreads, and how we can guard against it, that knowledge is genuinely empowering for managing your own health.
It moves you from just reacting to illness to being proactive about your well-being and the well-being of those around you.
Exactly. And that brings us to our final thought for you to consider. We've talked a lot about individual risk and protection. But as we head into those seasons where germs naturally spread more easily, think about this. How might a deeper awareness of conditions like pneumonia shift not just your personal health habits, but also how you view and participate in community health? What ripple effects could that awareness have?
That's a great question to ponder. How does individual knowledge translate into collective action in health? Something definitely worth thinking about.